Picture yourself lying on a reed mat in ancient Memphis, your body racked with fever. The physician approaches, his shaved head gleaming in the lamplight, carrying a leather satchel filled with remedies that would horrify any modern doctor. He opens a clay jar, and the smell hits you first. Putrid, nauseating, unmistakably fecal. This is crocodile dung, mixed with honey and dates, prescribed as a contraceptive suppository for women of the Nile. We think of ancient Egypt as the pinnacle of early civilization. These were the people who built the pyramids with mathematical precision, who mummified bodies so skillfully that we can still see their facial features 4,000 years later. They invented papyrus, created one of the world's first writing systems, and established a complex bureaucracy that governed millions. Yet when it came to medicine, their approach was a bewildering mix of genuine medical insight and practices so bizarre they seem like dark comedy. The Edwin Smith Papyrus shows us surgeons who could set broken bones with techniques remarkably similar to modern orthopedics. But flip a few pages, and you'll find prescriptions calling for the blood of worms, the fat of hippos, and yes, the excrement of various animals. These weren't the ravings of charlatans. They were the carefully recorded practices of Egypt's most respected physicians, men who served pharaohs and high priests. This strange duality reveals something profound about human civilization itself. Ancient Egypt stood at the crossroads between a world governed entirely by supernatural belief and one beginning to embrace empirical observation. Their medicine was a battleground where magic and science fought for dominance, often within the same treatment, sometimes within the same sentence of a medical text. Today we'll journey into the examining rooms and temples of ancient Egypt, where healing was as likely to involve incantations as incisions, where a physician might perform sophisticated surgery in the morning and prescribe mouse droppings in the afternoon. This is the story of medicine at its most human, desperate, hopeful, and occasionally revolting. The practice of Egyptian medicine emerged from a worldview that saw disease not as biological malfunction, but as spiritual warfare. In the Egyptian cosmos, illness was often the result of angry gods, restless spirits of the dead, or malevolent demons who entered the body through various orifices. The physician, called a sunu, wasn't just a healer, but a warrior in this supernatural battle, armed with both practical remedies and magical spells. Our primary window into this world comes from medical papyri that survived the millennia buried in Egypt's dry climate. The most famous is the Ebers Papyrus, discovered in 1862 and dating to around 1550 BCE. This document is massive, 20 meters long when unrolled, and contains over 700 remedies for everything from baldness to broken hearts. Reading it today feels like stepping into an alien world where the boundaries between medicine, religion, and magic simply didn't exist. The Ebers Papyrus opens with an invocation, beginning of the book of preparing medicines for all parts of the body of a man. But what follows challenges every modern assumption about rational medical practice. Recipe 821 calls for lizard's blood, swine's tooth, dog's dung, mixed with vegetable oils to create a hair growth treatment. Recipe 273 prescribes fat of a lion, fat of a hippopotamus, fat of a crocodile, fat of a cat, fat of a serpent, fat of an ibex, as a cure for baldness, presumably the logic being that these animals had impressive hair, fur, or scales. Yet scattered throughout these seemingly nonsensical prescriptions are moments of startling medical sophistication. The Smith Papyrus, dating from roughly the same period, contains descriptions of surgical procedures that wouldn't look out of place in a modern medical textbook. Case 6 describes treating a gaping wound in the throat. If thou examinest a man having a gaping wound in his throat, penetrating to the gullet, if he drinks water, he chokes, and it comes out of the mouth of his wound. It is very sore. The physician is instructed to close the wound with strips of meat and treat it daily until healing occurs. This dual nature of Egyptian medicine reflected their understanding of the human body itself. They knew anatomy from mummification. The embalmers who removed organs had intimate knowledge of internal structures. They understood that blood pulsed through vessels, that the heart was central to life, and that the brain was important, though they thought it produced mucus. But they also believed that invisible channels called mitu carried air, blood, tears, sperm, and spiritual essence throughout the body, and that blockages in these channels caused most diseases. Egyptian physicians were organized into a sophisticated hierarchy. At the top were the chief of physicians, who served the royal court. Below them were specialists, eye doctors, surgeons, and even dentists. The Edwin Smith Papyrus mentions physicians who specialized in treating specific body parts, suggesting a level of medical specialization that wouldn't be seen again until the Islamic Golden Age. These weren't primitive shamans dancing around fires. They were educated professionals who served apprenticeships, maintained medical libraries, and passed down knowledge through formal training. But their education included not just anatomy and surgical technique, but extensive training in magical practices. A physician had to master hundreds of spells, know the proper incantations for specific ailments, and understand which gods to invoke for which conditions. The god Thoth was called upon for wisdom in diagnosis, while Sekhmet, the lioness goddess, could either cause or cure epidemics. Medicine was as much about maintaining proper relationships with the divine as it was about treating physical symptoms. To truly understand Egyptian medicine, we must enter the house of a physician in ancient Thebes on a sweltering afternoon in 1400 BCE. The air shimmers with heat outside, but inside the mud brick building, it's cooler, thick with the scents of frankincense and something far less pleasant. Shelves line the walls, filled with clay pots, each carefully labeled with hieroglyphs indicating their contents. Some hold familiar medicinal plants, garlic, cumin, coriander. Others contain substances that would make a modern pharmacist recoil in horror. The physician, Khaemwaset, is preparing a remedy for a woman suffering from what we would recognize as a urinary tract infection. She lies on a low couch, her face drawn with pain, while her husband holds her hand and whispers prayers to Taweret, the hippo-headed goddess of childbirth and feminine health. Khaemwaset consults his papyrus scroll, running his finger along the hieratic script until he finds the appropriate recipe. The prescription calls for fresh bread, sweet beer, juniper berries, and the dung of a fly. The bread and beer make sense to modern eyes. Bread often contained beneficial yeasts, and beer was safer to drink than water from the Nile. The juniper berries actually contain compounds with mild antiseptic properties. But the fly dung? Khaemwaset carefully scrapes tiny black specks from a piece of rotting meat, believing that flies, which seem to spontaneously generate from decay, possessed magical properties that could drive out the demons, causing the woman's burning urination. As he prepares the mixture, Khaemwaset chants under his breath, "Come, remedy, come thou who expels evil things in this belly and in these limbs." He genuinely believes that the words themselves have power, that the right combination of syllables can compel supernatural forces to heal. But he also examines the woman's urine, noting its color and cloudiness, observations that would be familiar to any modern physician diagnosing a bladder infection. The treatment process reveals the complex psychology of Egyptian healing. Khaemwaset doesn't just hand over the remedy and send the patient home. He performs an elaborate ritual, burning incense while reciting prayers, drawing protective symbols on the woman's belly with red ochre, and instructing her husband on the proper times of day to administer the medicine. The patient isn't just receiving a drug, she's participating in a cosmic drama where divine forces are being marshaled for her recovery. But Egyptian medicine wasn't limited to internal remedies. The surgical procedures described in the medical papyri reveal a level of anatomical knowledge that seems almost impossible for a civilization without microscopes or detailed anatomical texts. Consider Case 27 from the Edwin Smith Papyrus, describing the treatment of a compound skull fracture. If thou examinest a man having a gaping wound in his head, penetrating to the bone, smashing his skull, and rending open his brain, thou shouldst palpate his wound. Shouldst thou find that smash which is in his skull, like those corrugations which form in molten copper? The comparison to molten copper isn't poetic flourish, it's precise observational description. Egyptian physicians had seen enough head injuries to know exactly what brain tissue looked like when damaged, and they understood that certain types of skull fractures were patterns they could recognize and classify. The papyrus goes on to describe symptoms we now know indicate traumatic brain injury, loss of speech, weakness in limbs, changes in gait. Their diagnostic accuracy was remarkable. Yet the same papyrus that demonstrates such surgical sophistication also contains spells to be recited during treatment. I have put that which is in its place. I have separated that which was confused. The physician was expected to perform both roles, skilled surgeon and magical practitioner, because illness wasn't just a physical problem, but a spiritual crisis that required supernatural intervention. The most bizarre aspect of Egyptian pharmacology was their apparent belief that disgusting substances possessed special healing powers. The Ebers Papyrus contains dozens of recipes incorporating human and animal excrement. Recipe 82 calls for human excrement, fresh, mixed with fresh milk, as a treatment for wounds. Recipe 618 prescribes ass's dung mixed with fresh milk for cataracts. The logic seems to have been that things which were taboo or revolting in normal life possessed particular potency when used medicinally, a kind of magical thinking that would persist in folk medicine for millennia. But perhaps the most revealing window into Egyptian medical practice comes from the contraceptive remedies prescribed for women. These recipes combine genuine pharmacological insight with magical thinking in ways that boggle the modern mind. One prescription calls for crocodile dung, honey, and sodium carbonate to be mixed into a paste and inserted as a vaginal suppository. The sodium carbonate would indeed have created an alkaline environment hostile to sperm, a principle used in some modern spermicides. The honey has natural antimicrobial properties. But the crocodile dung? That was pure magical thinking, based on the belief that crocodiles, as creatures associated with the fearsome god Sobek, possessed reproductive powers that could be harnessed to prevent conception. The preparation of these remedies was itself a ritualized process. Ingredients had to be gathered at specific times, dung of a fly collected before sunrise, and mixed while reciting particular incantations. The act of healing began not when the patient took the medicine, but when the physician began preparing it, transforming ordinary or extraordinary substances into vehicles of divine power through the correct combination of ritual action and spoken words. Egyptian dentistry provides another fascinating glimpse into their medical worldview. Dental problems were common. The bread that formed their dietary staple was often contaminated with sand from the grinding stones, wearing teeth down to painful nubs. The Edwin Smith Papyrus describes dental abscesses with clinical precision. If thou examinest the mouth of a person having ailment in his jaw, if thou findest a swelling protruding from his gum over the tooth which hurts, if that tooth is loose. But the treatment combined drilling out infected material with spells invoking Thoth to drive out the poison which is in the blood. The psychological dimension of Egyptian healing cannot be understated. In a world without understanding of bacteria, viruses, or cellular pathology, illness was inherently mysterious and terrifying. The elaborate rituals surrounding medical treatment served crucial psychological functions. They provided a sense of agency in the face of frightening symptoms, created meaning from suffering, and mobilize the patient's own healing responses through what we would now call placebo effects. But the most profound aspect of Egyptian medicine was its holistic approach to human health. Physical symptoms were never treated in isolation from spiritual, social, and environmental factors. A patient's relationships with family, their standing in the community, their ritual obligations to the gods, all were considered relevant to diagnosis and treatment. This comprehensive view of health would be familiar to practitioners of traditional Chinese medicine or Ayurveda, but seems almost alien to our modern, compartmentalized approach to healthcare. The deeper we excavate into Egyptian medical practice, the more we discover a civilization caught in a profound transformation of human consciousness. The gradual shift from a world explained entirely through supernatural agency to one beginning to embrace natural causation. This wasn't a clean transition from ignorance to knowledge, but a messy, contradictory process where new ways of understanding existed alongside ancient beliefs. Consider the intellectual courage required for an Egyptian physician to examine a traumatic injury and conclude that the patient's symptoms were caused by physical damage rather than divine punishment. The Edwin Smith Papyrus contains a remarkable passage where the physician observes a patient with a spinal injury. He discharges blood from both his nostrils. He suffers with stiffness in his neck. He is unable to look at his shoulders and his breast. Rather than attributing these symptoms to an angry god or demonic possession, the text matter-of-factly states that they result from a dislocation in a vertebra of his neck. This represents a revolutionary shift in human thinking, the recognition that observable physical causes could explain mysterious symptoms. Yet the same papyrus that demonstrates such clinical reasoning also instructs the physician to recite magical spells during treatment, revealing the incomplete nature of this conceptual revolution. Egyptian medicine existed in the liminal space between two worldviews, drawing from both without fully committing to either. The economic and social forces shaping Egyptian medicine also illuminate broader patterns of historical change. Medical knowledge wasn't distributed equally across society. It was concentrated among an educated elite who could read hieroglyphs and had access to expensive papyrus texts. This created a system where sophisticated medical knowledge existed alongside widespread folk practices that might be even more bizarre than the official remedies. Rural farmers and laborers who couldn't afford professional physicians relied on local healers whose treatments might involve even more creative applications of animal excrement and magical thinking. But the professionalization of medicine in Egypt also created incentives for careful observation and record-keeping. Physicians who served wealthy clients had to demonstrate results, leading them to refine their treatments through trial and error. The medical papyri contain evidence of this empirical approach. Some remedies are marked as excellent, good, or not to be used, suggesting that physicians tracked the effectiveness of their treatments and modified their practices accordingly. The religious dimension of Egyptian medicine reveals something profound about the relationship between belief and healing that remains relevant today. The elaborate rituals and magical thinking weren't just primitive superstition. They served crucial psychological and social functions that modern medicine is only beginning to understand. The sense of cosmic significance given to illness and recovery, the community support mobilized through religious ceremonies, the meaning-making that transformed suffering into spiritual journey. These aspects of Egyptian healing addressed human needs that purely technical medicine often ignores. Perhaps most remarkably, Egyptian medicine managed to produce genuine therapeutic benefits despite its bizarre theoretical framework. Honey, which appears in hundreds of Egyptian remedies, is indeed a powerful antiseptic and wound healer. Willow bark, prescribed for pain relief, contains compounds similar to aspirin. Even some of the seemingly absurd animal-based remedies may have had unexpected benefits. Fresh animal dung contains bacteria that produce natural antibiotics, which might explain why some excrement-based treatments actually worked. This suggests that the history of medicine isn't simply a story of progress from ignorance to knowledge, but a complex process where beneficial practices can emerge from seemingly irrational belief systems. The Egyptian physician who prescribed crocodile dung suppositories wasn't a fool. He was working within a coherent worldview that explained disease and healing in terms that made sense within his cultural context, and some of his treatments actually helped patients recover. The gender dynamics of Egyptian medicine also reveal progressive aspects that wouldn't be matched in the Western world for millennia. Female physicians practiced alongside males, and medical papyri contain extensive gynecological and obstetric knowledge that could only have been accumulated through careful observation by women healers. The Kahun Gynecological Papyrus contains 34 remedies specifically for women's health issues, demonstrating a level of specialized knowledge about female anatomy and physiology that suggests women played central roles in medical practice. Standing in the ruins of ancient Memphis today, surrounded by palm trees and the distant sound of Cairo's traffic, it's difficult to imagine the world of the Egyptian physicians. Their universe was animated by gods and demons, where every illness carried cosmic significance and every cure required negotiation with supernatural forces. Yet these same physicians performed surgical procedures that wouldn't look out of place in a modern operating room and made clinical observations that demonstrate genuine scientific thinking. The legacy of Egyptian medicine extends far beyond the specific remedies and procedures recorded in the papyri. They established the fundamental idea that healing could be both a technical skill and a spiritual calling, that effective treatment required not just knowledge of the body, but understanding of the whole human being within their social and cosmic context. This holistic approach to health would influence Greek medicine, Islamic medical practice, and ultimately shape healing traditions that persist to this day. Their bizarre remedies remind us that the history of human knowledge isn't a straight line from ignorance to enlightenment. Progress happens messily, with genuine insights emerging alongside persistent errors, effective treatments developing within seemingly irrational belief systems. The Egyptian physician who prescribed mouse droppings for stomach ailments was participating in the same fundamental human enterprise as a modern gastroenterologist, the attempt to relieve suffering and restore health through careful observation, accumulated knowledge, and therapeutic intervention. Perhaps most importantly, Egyptian medicine reveals the profound human need to find meaning in illness and healing. Their elaborate rituals and magical thinking weren't obstacles to effective treatment, but essential components of a healing system that addressed not just physical symptoms, but the psychological and spiritual dimensions of human suffering. In our modern world of evidence-based medicine and pharmaceutical precision, we've gained enormous technical capability, but perhaps lost some of the holistic wisdom that made Egyptian healing, for all its strangeness, a profoundly human response to the mystery of disease and recovery. The crocodile dung and mouse droppings may make us laugh, but they remind us that healing has always been as much about hope, meaning, and human connection as it has been about chemical compounds and surgical techniques. The ancient Egyptians understood something we're only rediscovering, that effective medicine treats not just the disease, but the person who carries it, embedded in a web of relationships, beliefs, and aspirations that give life meaning even in the face of suffering.